Hello, everyone, and thank you for joining us today. Interpretation will be available soon. Thank you for your patience. Bienvenidos a todos. La interpretación al español va a estar disponible muy pronto, así que agradecemos su paciencia. The National Center for Farmworker Health is pleased to host this training on the avian flu H5N1, and we'll focus on outreach planning. So our speakers will share tools and safety protocols to do outreach to production and animal workers. And for those who may not be familiar with the National Center for Farmworker Health, we are a nonprofit located outside of Austin in Buda, Texas, and our mission is to improve the health of farm worker families. And we do that by providing programs, trainings, and technical assistance and resources. And we are very happy to serve our network, including migrant and community health centers across the country. I am pleased now to introduce our guest speakers, Dr. Bethany Bogues-Alcauter. She is a Research and Public Health Programs Director, and Josue Ruiz, who is our Data Analyst at NCFH. So I'm going to hand it over to Bethany. Thank you.
Thank you, Lisbeth. We're going to cover quite a bit in here, but we have resources. We know some of you are already doing really important work doing outreach to animal production workers. And so the focus of this training is to help you, give you some tools to kind of start planning outreach activities or to expand your outreach to animal production workers. And then we're going to spend a lot of time going over some safety guidelines for you if you are doing outreach on farms or to animal production workers at their house or out in the community. Next slide, please. Okay, we have a few just background slides about H5N1 bird flu. Some of you may have seen some of these slides in our earlier presentations, but I wanted to make sure everyone has this information. So a little background on bird flu. Scientists identified bird flu about 30 years ago, and the first outbreak was in birds in China. It did spread to humans then and caused 6 human deaths. It kind of died down and then popped back up in 2003 in Asia. And then by 2005, it had spread to a number of continents. So it was all over Asia, Africa, the Middle East, and Europe. Again, mostly in birds, although in some mammals at that time. We didn't have it here in the US and in Canada until 2021. In 2022 is when it started affecting all of our poultry here in the United States. And interesting factoid, when bird flu was really bad in 2022, the average cost of a dozen eggs here went from $1.82 up to like over $4.50 a dozen. So the bird flu killed so many chickens here in the United States. It more than doubled the cost of eggs here for a while. Next slide, please. So now, since 2020, it's really sped up, the spread of bird flu, especially in different kinds of mammals. So normally when we see bird flu in mammals, it gets passed because it's an animal that eats birds. So like a fox or something like that, a fox or a cat will eat an infected bird and then they get sick. There's some evidence that back then it might have been spreading not just from birds to mammals, but mammals to mammal as well. But what we're seeing now in cows is really the first time that we know that bird flu is spreading mammal to mammal, so cow to cow. Go ahead, Lisbeth. Cows are a new host for H5N1. There's some disagreement on if it first started appearing in cows here this year or if it started late last year. A lot of folks think it started in December of last year. It's a little odd. We still aren't quite sure how cows started getting bird flu because they don't eat birds. Cows don't eat it. So, it could have been contaminated feed or contaminated water or something like that. And they do believe that it started from wild sick birds infecting cows in North Texas. It's now H5N1 has now been detected in dairy cows in 14 states in over 200 herds. I think it might be up to like 207 today. And it's been detected in poultry in 48 US states. A lot of dairies aren't testing their animals right now, so this is probably just some small proportion of the herds that are infected. Go ahead, Lisbeth. So in humans, there are cases of bird flu popping up in many countries. Right now in the US, we've had 15 cases since it first appeared in 2022. In those 15 people we know that they were infected with H5N1, 14 of them were farm workers, either poultry workers or dairy workers. We recently had one case in a human in Missouri, and it's still unknown how this person got H5N1. They're doing a lot of investigations right now to kind of try and figure that out, but it seems like that person's family, their household members, did not get sick. It was just that one individual. So kind of the official public health stance is that bird flu is still considered a low risk to the general public. But it is a high risk if you're working with, poultry or dairy cows. Next slide, please. The folks most at risk are those people who are directly working with animals, which will include, people like milkers and feedlot workers, but it also includes veterinarians and vet techs. It includes certain types of slaughterhouse workers, and it also will include first responders, so public health staff that are going and doing investigations into outbreaks, or many of you who might be visiting farms where they potentially have H5N1. So you would also be considered at risk if you do visit those farms. Next slide, please. Okay. So we're going to talk about a tool that we're piloting, and we want to get feedback from you all in this in just a moment. So I'm going to give an overview and then I will move to sharing my screen. But Lisbeth, if you don't mind advancing the slide. So what we've been doing, there's a lot of questions about dairy workers, sort of from a high level, from a national level, and then on a state level, where dairy workers are, and then how many of them there are. NCFH as an organization has done a lot of work in estimating the number of farm workers and their household members that live in every county in the United States. Dairy workers is really hard because basically the more specific piece of information you want, then kind of the narrower the data set gets. So data gets suppressed, which means like the government, the USDA, or different data sources will block off certain pieces of data because they're trying to protect the privacy of producers in those counties. So if you're in a county where there's one or two big dairies, it's likely that we wouldn't be able to get any data about the number of workers in that county because there's too few producers there. So what we've done to kind of test out a possible way to get an idea of how many dairy workers there are in a county is to instead look at the number of cows, because the number of cows in a county is pretty good. There's might be some counties that are missing that information, but this is a lot more complete. So what we did is that we looked at an industry standard of estimating that there's one dairy worker for every 100 dairy cows on a farm. That you'll have to share information if you have it about your area. We think that on the East Coast, where a lot of farms are smaller and, more smaller family farms, more manual, this might be wrong. It might underestimate the number of workers, right? So there might be more like one worker for every 50 or 60 cows. If you move to the Midwest or the West, where there's a lot of dairies that are very large and mechanized, this might overestimate the number of workers. So in some dairies, I visited a dairy recently where there was about 280 cows for every worker. So you'll have to take it with a grain of salt, and we would love your feedback on these estimates as well. But based on everything we found nationally, 1 worker for every 100 cows seems like a good place to start. Go ahead, Lisbeth. The other thing we have on this map that we're going to share in a moment is dairy farms or dairy processing sites that were inspected by the Food and Drug Administration. And that's from a big range of time between 2009 and 2024. We got this big range because we really wanted to get an idea of where dairy farms might be located, and then also kind of look at that in conjunction with our estimates of workers, because if there are a lot of dairies and there aren't a lot of workers, our estimates could potentially be off. Go ahead, Lisbeth. So this is what the map looks like. And if it's okay, Lisbeth, I'll go ahead and I'll share my screen so we can explore this map for a minute, and then we'll break out into some groups to get y'all's feedback on this. And let me go ahead and put this link in the chat. Everybody should be able to access it. Oh, that's great feedback, Elise, that you also use that ratio of workers to cows. Okay, so you'll see here that you can turn these, there's like 2 layers. So blue dots is a layer. That's the inspected dairy farm sites. And then the red shaded counties are the estimates of workers. So you can click on this little rectangular box. I'm going to turn the farms off so we can just see the counties for a moment. So I'm looking at the whole US. I can see here there's some really dark red counties over here in California. So for example, I'm looking at Fresno County right now. And assuming there's 1 worker for every 100 cows, we estimate that there's 1,150 dairy workers in that county. If I look at a lighter county, like let's look over here in South Dakota. This is Tripp County, South Dakota. There's only an estimated 3 dairy workers. So this will give you an idea, and it has up here the buckets. If you wanted to only look at higher ones, you can click on that and say keep only these. So you can see there's only a tiny handful of counties in the US where it's likely that there's more than 1,000 dairy workers. And how do I go back? I forget how to switch it back. Just going to refresh the page. So that's how you can get an idea anyway of how many dairy workers are in your county. Then, so let's go back over here to where there was a bunch of, oops, let me do it this way. I can use this little box thing to zoom in on an area of the map. So now I can see in Fresno County where there's farms. So for example, here's this dairy in Dinuba, California. Here's some more dairies. We don't really have much more information. So you can use this and then look up an address. You might have your own information about these dairies and you can use it to build a spreadsheet, but at least you know roughly where in the county, especially if you're located in a bigger county, where more dairies might be. We have not, gone through and like validated or double checked all of these locations. And it is just a big public database of FDA sites. There isn't a lot of public information about where dairies are. If you know of any, we can certainly check those out and incorporate it into our map. But again, this is a starting point. So what I want to do is, oh, thank you, Lisbeth, for putting that in there. What I want to do is to have us break up into some groups by region. We'll just spend a few minutes and we can kind of explore the map together, and NCFH staff will be in each group. And what we'll do is talk about some of the estimates in your area if you think they seem very low, very high, or about right. Potentially other ways to find dairies that you think we should look at. And I'm seeing items in the chat that people found other data sources, which is awesome. So anyways, we can help build out this map and create a tool that people can use. We would love all of that feedback in these small groups. So let me stop sharing so we can do the breakouts. If folks could mute themselves again, unless they have a question, that would be great. Thank you. Okay. So we've had lots and lots of questions about safety and outreach. If you're in a state that has H5N1, and how to stay safe if you're doing on-farm outreach or in the community or to workers' housing sites. So we drafted these recommendations. This is based on the information available now. So of course it could change as information changes about H5N1. If there are drastic changes, we'll work to update these guidelines. They're also available in a PDF form, which we can put in the chat in a little bit. But it is based on what NIOSH has told us. NIOSH is the center at CDC that works on workplace health and safety research and recommendations. So we worked with them to come up with some of these guidelines and based it on what they had recommended. So us at NCFH, not CDC, we're generally recommending not to do a lot of outreach on dairy or poultry farms right now, even if you're not in an H5N1 state. This is because the testing isn't as comprehensive or rigorous as it really needs to be. And I'll give you an example. A few weeks ago, me and my colleagues were in California. This was before California had detected H5N1 in dairy. We went to one random dairy. I talked to one random worker, and that worker had every symptom of H5N1, and the cows, their milk production was down, which is a symptom of H5N1. And then 2 weeks later, it came out that it is in California. So even if you're not in a state, that has detected it, it's still possible that it's there, and you want to be cautious. So unless there's really a need to do outreach on a farm, like the producer has asked that you come, the health department has asked that you support them, we recommend trying not to do it. We do have recommendations, though, if you need to be on a farm. Now, if there's a documented H5N1 infection on the farm, there really hopefully won't be any reason for anyone to go there. We just recommend minimizing it because of this issue, that there hasn't been such great testing protocols on dairies. And then it's important that all your staff, before they're doing outreach, that they know how H5N1 spreads, how to prevent being exposed to it, and what the signs and symptoms are. So we cover that right now. You can share this recording or these slides with your colleagues and go over it with them as well. So what we know right now is that being exposed to milk is a big risk. So if you're in a dairy parlor, obviously there's risk of that. Or even if you're just standing near a worker and the cows are in like a holding pen waiting to be milked. And if that worker is got a hose and they're spraying down the floors to keep the floors clean, that could, bring milk droplets into the air, and you would be at risk, even though they're not actively being milked. So really anywhere around milk cows, there's some risk of being exposed to their milk. For poultry and for cows, there's a risk of breathing in dust with manure in it, and that manure could infect you. So poultry litter is an example. If you are near, like a feedlot again, or a holding pen where there's a lot of manure that's dried, especially if it's windy out, that could get in your face, and that's another risk of exposure. Touching surfaces on the farm that are contaminated. If anyone's been to a dairy farm, probably any surface is contaminated. You know, to some extent, there's a risk of that. So you want to be careful about what you touch. And then just being around any sick animals or being in buildings with animals that might be sick, that is another risk of being exposed. Human to human cases, so being around a sick human and not the animals, this transmission is very unlikely. We haven't seen it in the US. It has been documented though in Asia. Very limited and very rare. So the chances are low, but it is possible. I'm going to catch up on a couple questions in the chat. So we're going to cover right now, I'm about to jump into recommendations for if you're on the farm doing outreach, and then we'll move to recommendations for if you're at workers' housing sites, which presumably would be off the farm, or in community sites like grocery stores, laundromats, things like that. Yeah, and then I'll come back to questions in a minute. So these are signs and symptoms. I think it's really important for all outreach staff to know the signs in humans, the signs in cattle, and the signs in poultry. Because again, if you go to a farm, you think there's no H5N1 here, you can kind of assess your own risk and what you might need to do if you observe these signs. The hard part is animals can get sick with a lot of stuff. Humans can get sick with a lot of different things, right? There's a lot of COVID, there's a lot of normal flu, there's all kinds of things. So just because someone has these symptoms doesn't mean they have H5N1, but they could. So it's better to be cautious. So in humans, in all the farm worker cases in the US, they've all had red eyes called conjunctivitis. Sometimes their eyes swell up, or sometimes it's just red in one eye or both eye. However, they can have H5N1 without having that. It's just been a common pattern among farm workers here in the US. Sometimes people can get fever. Sometimes they have a cough, a sore throat, a runny nose, muscle or body aches, headaches, fatigue, trouble breathing. If it gets bad, they can get pneumonia. People can also have diarrhea, nausea, vomiting, even seizures, but this is not common. So it's kind of unlikely that they will have that. In cows, the biggest thing in cows is that their milk production goes down. And this is because they're feverish. They don't want to eat. Cows don't want to eat when they're sick. That's like a natural animal instinct, is they just kind of stop eating when they're sick. So that's why cows' milk production goes down. It's not actually an effect from the virus. It's just an effect from them being sick. Their milk also will be off. It might get thicker. It might get discolored. And then some cows might have nasal discharge, just like humans. And then in poultry usually don't live very long if they get bird flu. But if they are, they'll get really sick. They also won't eat much. They'll have low energy. They don't walk around much, and when they do, they might not have good coordination. They also get a lot of nasal discharge and sneezing. I used to raise egg-laying chickens, and they would get different types of bird flu sometimes, and they would sneeze a lot when they would get it. You can also see swelling. Different parts of the chicken's body might swell or become discolored, and diarrhea is also common with chickens that are sick with bird flu. Okay. So this is for on-farm outreach. These recommendations are pretty thorough. Again, if there's H5N1 on a farm, we wouldn't recommend you go unless you really need to. These recommendations are what you would follow if there is H5N1 on the farm. They're also what we recommend you follow unless it's like confirmed. There are a few farms in that USDA program where they're testing the cows periodically and making sure they don't have H5N1. That's a different case, but it's so small that we haven't put that consideration in these guidelines. Basically, in these guidelines, if you go onto the farm, we're kind of assuming that there's H5 there. There may not be, but again, better safe than sorry. So if you're going to be on a farm, a dairy or poultry farm, and if you're going to be near the animals or in buildings that have, a shared airspace with animals, then this is the PPE that is the CDC is recommending that people use, and it's a lot. So first thing is a NIOSH approved N95 respirator. So a lot of us call those masks. We were using them during COVID. They're actually respirators. They need to seal around your face. So if there's a gap under your chin, if there's a gap, here by your nose, then milk droplets or the dust can get in and it's not really protecting you. We have a couple links in here that are in the slides that show a video for how you can make sure those N95 respirators are sealed. You can also share that information with workers too. Surgical masks won't work for this. So you need to have the N95 respirator. The other recommendation is fluid resistant coveralls. We have a picture of all this in a moment. The other thing is goggles that also seal to your face. So you don't want to have gaps there. A face shield is recommended too, like those plastic face shields. Again, we use them sometimes in the early days of COVID. You would want to use that if there's a pretty high chance of cow's milk splashing in your face. So that's the bigger concern there, is that just in case your mask didn't seal or your goggles didn't seal, a face shield would protect you if you're in the dairy parlor and you're right by all the cows being milked. If milk splashed in your face, the face shield would protect you. Gloves are recommended, a head or hair cover, and rubber boots. You can also use disposable boot covers, but those tend to tear a lot on a farm. They're not as effective as wearing rubber boots. So this is a picture of all the PPE. You could also use an apron for extra protection if you needed to, but fluid resistant coveralls are also pretty good. If you're going to be on a farm, but you're just outside, you're not near the animals, we would still recommend that you use PPE. It's just not as intensive. For that type of setting, we would recommend that you use the N95 respirator, gloves, and rubber boots. But the coveralls, the face shield, that's all not necessary because there's not the same risk of milk and getting in your face. And Lisbeth just linked folks to the PDF of this protocol. I think we still need to translate it in Spanish. It is all translated here in the slides, but I think we need to translate the PDF version. So we'll get that updated soon. And that link will contain the updated information. So this was a big problem in Colorado when all the poultry workers got sick. It's becoming a little bit less of a concern right now in some areas of the country, although here in Texas, it's still like 100 degrees. If you're using all this PPE, like the coveralls, the respirator, etc., you can overheat really, really easily. So if you're in an area that's still pretty hot, over 80 degrees, or you're in a building where it's pretty hot doing this outreach, then outreach staff will hopefully have already done a heat safety training, but maybe might need a refresher on that so they know what signs and symptoms of heat-related illnesses are and how to prevent them or treat them. You'd want to drink plenty of water and electrolytes, and you need to take breaks too. It might be every 10 or 15 minutes. A lot of this is going to depend on you and how you are. There's no need to push yourself. You should take breaks as often as you need to. You probably need to remove the PPE to really get cool and to not overheat while you're doing outreach. And then, of course, we always recommend that people do outreach in pairs for a variety of safety reasons, but here it's important as well so that you can check on each other and recognize signs and symptoms of heat-related illnesses in your coworkers. So you can help them get medical care if they need it. Maggie has a great question about visual resources. So there is the PPE drawing, and the CDC has made their information available in quite a few indigenous languages. We have a flyer that's not as visual. It has a lot of written information, but we're working on making that flyer available in several indigenous languages, and it has an audio recording of all the information that workers can access through a QR code on there. And then some of my colleagues are finalizing a completely visual flip chart for this information. So we're hoping to have that done and to share with you all very soon. We know there's so many languages spoken in dairies that we wanted to do an all visual resource. They take more time. And if folks know of resources, feel free to share them in the chat as well. All right. So in addition to PPE, you want to make sure you're staying clean, keeping your body clean. So some of those recommendations are to keep all your open wounds, like any even minor cuts or scratches, you would want to cover that with bandages. If you're on the farm, it's better to leave all your belongings in your vehicle rather than leave it somewhere on the farm where it can get contaminated. You want to avoid touching your mouth, nose, face, or your phone while you're at the farm, because again, you could increase your risk of exposure that way. And then always practicing good hand hygiene, washing your hands with soap and water, before and after the visit, during your break. Like if you take a break to take off your PPE, you would want to wash your hands after you take off PPE. If you've had any contact with animals or milk, if you're in a dairy, it's common to get like poop flung on you or something like that. So you would want to be sure and wash your hands if that happened. And then if you've had contact with people who had signs or symptoms of influenza, you would want to do that as well. And then basically anytime you touch your PPE, as soon as you're done touching it, you need to wash your hands. There is a certain order. If you're wearing all the PPE in a dairy parlor, there is a certain order in which it needs to be done. We have that link here. It's detailed. It'll take some practice to get used to. We're not going to spend a whole bunch of time on that here, but that resource is there for you to access that has all the instructions on taking PPE off. Now, if you're doing outreach on a farm and you have reusable PPE, so like those coveralls, let's say that's not disposable, you need to reuse it. What I would do is go to your car, take it off outside of the car. If you can clean it off there, that's great. But if you can't, then you could bring a trash bag, put the dirty PPE in the trash bag, tie it up real good, and then put it in your car, just so that you're not getting dirty PPE in your car. You'd want to wash your hands once you're all done. And then if you are wearing those rubber boots that you used on the farm, if you're wearing them in your car, you would want to wipe those down with a disinfecting wipe, just because there's some evidence that we might be spreading bird flu from farm to farm that way. So in addition to shoes, there's some evidence that vehicles or machinery is another way that bird flu is being spread farm to farm. So this isn't so much for your health, but out of public health interest and interest of the cow's health as well. So if you can avoid parking on the farm, we'd recommend you do that. If you do need to drive from one farm to another, and you did have to park on a farm property, then we'd really recommend you wash the tires pretty thoroughly with a hose, or even if you have to go through a car wash beforehand. It's a pain, but it's better than spreading bird flu. So park off the farm as much as you can. So hand sanitizer, Yeah, hand sanitizer can be used and it can be used in a pinch if you can't wash your hands thoroughly. However, I wouldn't touch my face before I had been able to wash my hands thoroughly with soap and water. So it does help, but I would do that. I wouldn't trust it entirely. And then, of course, you want to take care of your own health. If you're able to get the seasonal flu vaccine, it's a good step to do. It's not going to protect you against H5N1 infection. What it is going to do as we move into the fall and winter, which is our normal flu season, is it's going to reduce the risk that you get normal human flu, get really sick from that, and then you get H5N1. We don't want that to happen. So any way we can reduce that risk, just like being careful about wearing PPE and washing hands, getting vaccinated for seasonal flu is another way to kind of help protect your body and the risk of having to fight two different flus at the same time. If you've gone onto a farm and there were people that had any signs or symptoms of bird flu, animals had any signs or symptoms of bird flu, you would want to kind of watch yourself for 10 days after you went to that farm. If you become sick during those 10 days, it'd be wise to isolate, talk to your supervisor, or follow whatever your organization's protocols and rules on that are, and then seek medical attention. Even if you don't feel terribly sick, it's wise to go in to the doctor if you think you may have been exposed. And this is because they can, if you tell the provider, like, hey, I was out on this farm, I talked to a guy that had conjunctivitis and a cough, and now I have a cough. They can do the test for flu and H5N1, but what they'll also probably do is give you an antiviral medication. And that antiviral medication will really reduce the risk that if you do get sick, it'll help reduce the risk that it becomes severe. So it lightens the severity of an infection, and it's important to take it sooner rather than later. Okay. Any questions on that section? I'm going to pause real quick before we go to housing and community. Oh, thank you. Yeah, thank you for sharing the Western NIOSH Center's bird flu safety messages. I'm just checking. Okay, so Hannah asked a good question. We have a CHW doing regular case management with workers on dairy farms, including driving them to appointments. Based on this outreach guidance, should we ask her to stop doing this? They're in Maine. So Maine is not currently an H5N1 state. And it hasn't even really hit the East Coast, it seems like. But what might be a good idea if you're in a situation like that is to do some kind of screening, and then decide internally what you'll do based on the results of that screening. So, if she's driving people around, that's pretty close proximity. So before that happens, you might want to screen the worker to see what symptoms they have. And then you would decide, I think. So for example, if the dairy worker says, well, I have sore throat and cough and a fever, that could be a lot of things. You could choose not to drive that person. You could choose that person and the CHW both wear N95 masks that are well fitted. Again, during COVID, we were all doing this. We were like all driving around sick farm workers. But we would put on masks and we would open the windows to the car, do anything like that to reduce the risk. So, I think it depends on the organization, kind of how conservative you want to be. Because there isn't H5N1 in that state, and because we still haven't seen human to human transmission, I don't know if it's necessary to stop that completely, but you certainly would want to be alert for any changes in the situation. Um, and certainly mask wearing, especially if anybody has any kind of symptom, might be good. All right. So let's start with housing and community sites. So these recommendations that follow are assuming that you are not in contact with workers who have symptoms of H5N1. We'll talk about what to do if they do, but these guidelines are for scenarios where workers are healthy. PPE, if you're going to housing sites that are not right on a dairy farm, or if you're going to community sites, again, like grocery stores, laundromats, places like that, PPE is not necessary at this time. You could choose to wear a surgical mask or an N95 respirator. Again, that's, I think, up to your organization. It's up to you. You know, do you have other health conditions? Do people in your family, are they immunocompromised? Things like that, because we have a lot of COVID. It's going to be normal human flu season. So even if you're not worried about bird flu, there's still a lot of things that might make you sick this fall. So, you know, it wouldn't be a bad choice to wear a mask. It's kind of up to you and your organization. But officially, we don't think it's necessary at this time. However, we would recommend that you keep N95 respirators handy in your car or somewhere nearby when you're doing outreach in case you come across a worker who does have H5N1 symptoms. So again, you want to have good hygiene, keeping your wounds covered with bandages, not touching your mouth, nose, your face, your phone while doing outreach, washing your hands. And again, if you're using masks, after you take off a mask, you should wash your hands or use hand sanitizer until you can wash your hands. And again, same here. Get vaccinated for seasonal flu if you're able to. And then, you know, kind of monitor your own health, especially if you had an interaction with a worker who had symptoms. You would want to use that same rule of monitoring yourself for 10 days. So what do you do? What do you do if you do talk to a worker with H5N1 symptoms? Well, if you know beforehand, and we talked to Nash about this, if you know beforehand that a worker has the symptoms before you visit them, we really strongly recommend that you speak with them remotely by phone or video call. So again, unless you're in a position where you really have to talk to them, we would recommend you do it remotely until their 10 days has passed. If you have to meet with the worker and they have symptoms, we'd recommend speaking outdoors. Ventilation is good. And using the N95, using gloves, and Nash recommended using goggles in this scenario as well. This is for the risk, I think, of like any off chance that saliva could pass. But again, I think it'd be better. Hopefully the worker would be willing to put on a mask as well as the outreach worker. And that way, when both people are masked, the risk is much, much lower of anything being passed. If you aren't aware of this and just run into a worker like I did, you're just doing outreach and the worker tells you like, oh yeah, I've been sick for 5 days and have all these symptoms. Well, then that's when your N95 respirator comes in handy. Again, you would want to put it on and encourage the worker to put one on as well. And then be sure to wash your hands really thoroughly after that outreach visit. And here in this case, if you did have some interaction with the worker who had symptoms, you would really want to make sure you're monitoring yourself for 10 days following that outreach visit. All right. The last little part here is about influenza testing. This applies to dairy workers as well as to all of you. You're in the at-risk group. So this has been a little tricky in some places, and it is going to vary state to state, county to county. So these are kind of some basic guidelines, but it might look a little different where you are. In general, the first place you would want to go to is the health department. probably the county health department, unless you're already connected to the state health department. By now, especially if you're in an area that has a lot of animal production workers, they should all be pretty well versed in this, all the health departments, and they should be able to test you. And it is going to be more efficient because you can also go to a hospital or an urgent care or a place like that, but it's unclear how knowledgeable providers in these places have been educated about bird flu. So you might have to do more explaining, and it might just be a little more challenging of a situation. Health centers, a lot of you work in areas where there are migrant or community health centers. There, again, I think they have better knowledge of bird flu than just like a random urgent care. And they can work with the health department to get the right testing done. But in most states, what we've been told, the first stop is going to be the local health department. But either way, if you don't know that contact for the health department, we're happy to help try to track those down for folks. But you can go to a health center, to a hospital, to an urgent care to do the testing. You would just really want to emphasize to the healthcare provider that you or this worker has been exposed to sick animals and that bird flu is a concern. Ruby has a good question about if the health department charges for testing. This again, so it might vary a little bit, in the places where there have been outbreaks of H5N1 in people, they're not charging for testing. If I'm in a place where H5N1 isn't documented yet in dairies, I'm not entirely sure how that's working in every state. So like Mississippi, for example, they don't have a lot of dairies. They don't have H5N1. I'm not sure if the health department would charge for that. But I have a number you can call if you run into situations like that. An important point here is the timing of testing. In COVID, we had to be pretty fast. For flu testing, you want to test within 7 days of your symptoms starting. I think that I forgot to look up the early part. I think within a day or two of symptoms starting, it's pretty reliable. But you do want to doing it after 7 days, it'll be less reliable, the result. So getting tested within a week is best. And most of us have had a flu test. They swab your nose. It's not pleasant. If they're looking for bird flu, most healthcare providers now are swabbing the nose and the eye, because in some of the farm workers, sometimes it was positive in the eye, negative in the nose. Sometimes it's positive in the nose, negative in the eye. So they're doing both right now to be sure they're catching the bird flu cases. So here's more information about the antiviral medications. In some cases, they're giving it to, everybody's coworkers in the farm if someone has H5N1 or their household contacts as well. But it is good to get people in, because if they think they have H5N1, they'll probably give them this antiviral medication. There's quite a few different ones, so I didn't list all the names here. And those medications should be free for all animal production workers. And I believe they should be free for outreach workers as well. But do tell us again if that's an issue. But so far what we've seen is that that's being distributed without any charge. If you do need help, we have a line that helps farm workers find healthcare in their area. And if you need help connecting to the health department or something like that, you can also use this line. You can contact me or my colleagues directly, but this is another good resource. For example, if there's a worker that contacts you and he's way in another state or something, this helpline can help him find the right place to get tested, him or her. And that can be via WhatsApp or a regular phone call. All right. There's a few more resources. I know we've shared a lot in the chat, and then some partners have shared their resources as well. We have some of the CDC materials on here. There are new CDC materials coming out. There's more kind of graphic images coming out soon. And then we'll have that flip chart posted as soon as possible. One thing we do ask is that as you're doing outreach to dairy workers, if you're seeing a particular language, that you need information in a particular language, if you could let us know and we share that with CDC and other partners so that people are kind of aware of what languages dairy workers or poultry workers speak so that we're getting information out in the right languages. All right, let me go to questions. So Jesse has a question. Does anyone know if there's a rapid avian flu test kit available? People might have more up-to-date information than I do, but what I know based on information I received maybe 2 or 3 weeks ago, those are being developed, but not ready yet. But they are in the works. Are there any other questions that folks have? You can use the chat or you can say it out loud. Si alguien tiene otra pregunta, pueden hablar en altavoz o pueden usar el chat en inglés o español.
Hi, Bethany. It's Hunter from Project Protect.
Hi.
I am just wondering if you can share any additional information about the case in Missouri and if the USDA, or not the USDA, if the CDC has any more information than what's publicly available through journalism outlets.
Yeah. Well, yes and no. I was on a small group call about that case last week with the CDC and USDA. What they said is that that case was identified retroactively. So, these farm worker cases, like people have gotten sick and then they get tested for flu and then they find that they subtype it and they find that it's H5N1. What happened with this case is they've started doing lab surveillance. So somebody, in this case in Missouri, somebody got sick, they got hospitalized, and the doctors did a variety of testing. And whatever testing they did for flu gets sent to this, central lab. And so the CDC has been going through all those samples. They've gone through like 50 or 60,000 flu samples to subtype them to see what type of flu people are getting. And that's how they found this person's case. So it was part of a random sample of different, booger swabs that they found H5N1. They don't know how this person got H5N1. All they've told us is that the Missouri Department of Health is doing a thorough investigation. They have like a long questionnaire that they're using to go through that person's history to see if it was, raw milk or exposure through a cat or a wild bird or something like that, but they haven't said anything else about how that happened.
Okay, thank you. Well, stay tuned. It's scary a little bit.
It is a little bit. Yeah, it's definitely odd. Yeah, because this person, they just said they didn't have any known exposure to animals. So we'll see. I'll do Anna's question and then Jesus's. So what about a bird flu vaccine? Great question. I think there's 8.2 million doses of a bird flu vaccine that the federal government has stockpiled. They have that ready. They have decided not to do that yet. That's for a lot of reasons, and we could talk about weird things in public health history, including a fiasco with the swine flu vaccine in the 70s. But basically, because the mortality rates for bird flu have been declining over recent years, and because we have not seen severe illnesses here in the US, they're kind of choosing to do this route of if anyone pops up with bird flu, we'll give them the antivirals. And that's really effective at reducing the severity. I think if we start seeing like, hey, maybe it's going, being transmitted between humans, or if it starts looking like more serious, that's when I think they might start vaccinating people at risk. But right now, they're not doing that, and they haven't said they will. But it is there. And they're also working on a bird flu vaccine for cows right now. All right, Jesus.
Buenas tardes, gracias por la presentación. Mi nombre es Jesús y estoy con la organización Proyecto Mixteco en la costa central de California. Tengo una pregunta. ¿Qué pasa con los productos lácteos y la carne eh, cuando hablan de la contaminación de las granjas? Gracias.
Si están contaminados, pues, ok. Eso es la cosa. La leche cruda sí tiene el virus. Y si gente están tomando la leche cruda o si están comiendo queso que está hecha con la leche cruda, hay riesgo de infectarse, de contagiarse. Igual con carne, si no está cocido bien, hay riesgo de contagiarse también. Menos con carne, porque parece que el virus está muy concentrado en la leche, en las vacas, pero en ciertos casos han visto el virus en otras partes de la vaca, incluso de la carne. Entonces sería prudente para evitar carne como más cruda y especialmente la leche cruda. Am, Están haciendo pruebas de carne cocida y también de leche que está pasteurizada y parece que no hay riesgo. El virus está presente, pero está como descompuesto y no se puede infectar la gente así. Entonces, sí sale en las pruebas que está ahí en la leche, pero no, todavía no hay riesgo que las personas se pueden contagiar con esta leche si ya está calentada.
Muchas gracias.
Gracias a usted. Just to say this briefly in English, he asked about what about the risk of contaminated milk or meat with H5N1. And what I said is that raw milk or undercooked meat is a high risk. Really wouldn't drink raw milk right now. And I'm a person who has drank raw milk in the past. I'm not entirely opposed to it, but I wouldn't drink it now. The virus can be passed in the milk, same with undercooked meat. But they are doing a lot of testing of pasteurized milk and cooked meat. That doesn't seem like it's any risk. What they're finding is that the virus will come up in pasteurized milk, but it's broken down so much that it can't actually cause an infection. All right. Julia has a great question. I've never swabbed the eye. How is this done? I'm not entirely sure. I know there is a protocol, a clinical protocol on that. We can, if you put your email in the chat, I can send that to you over email. Maria has a fantastic question. Drinking this, if the virus is in the pasteurized milk, but it's broken down, does that mean we gain immunity? I mean, maybe. That seems very logical. I don't think that anyone is looking at that, and maybe it could. I don't really know. Some people think that maybe dairy workers are not getting so sick from H5N1 because they've already been exposed to it, and maybe they might have a stronger immune system response to H5N1 than the rest of us. So I don't know, but it's a really good question. All right, I'm going to close this so we can do our evaluation. If you have more questions, you can put them in the chat with your email and we can follow up via email. But I will pass it to Olivia now.